these are minute things, but it makes a lot of difference for someone who's going through it. If you want to get better, you'd really put in that effort, because so many people believe that I just take the medicines and I'll be fine the next day. All of these are minute things, but it makes a lot of difference for someone who's going through it. It's like glasses for the brain, wherein you function in a better way so that you go back to your actual lifestyle. When someone starts having hopelessness feeling, like, they feel like, what's the point of living?
Hi, here we are again. This is Ellen Chamberlain with the Mind Reimagined, Paths to Mental Wellness. On the podcast today, we will be speaking about depression with an expert. Dr. Manasvi is a dedicated psychiatrist with over 7 years of experience in the field of mental health. She completed her MBBS and holds an MD in psychiatry. She has experience from institutions like NIMHANS as part of her training. Dr. Manasvi currently works as a consultant at Marga Mind Care and with People Tree Hospital in Bangalore. Known for her empathy, she works towards destigmatizing mental illness. That's what we're about here at the Mind Reimagined. And she is committed to a holistic approach to patient care. Her areas of expertise include mood disorders, schizophrenia, anxiety disorders, and psychosexual disorders. She also has a keen interest in keeping up to date with new treatments and research happening in psychiatry. Today, we will understand and begin to navigate depression. Dr. Manasvi, thanks for joining us. Let's talk about understanding and navigating depression. This is a good topic to talk about today because it's a condition that affects so many people, some that know that they have it and some that don't. To start, can you help us understand what clinical depression is and how it's different from just feeling sad?
Hi, Ellen. Thank you so much for having me. So depression is something which is really common nowadays. A lot of people say that they have it, but it's very misunderstood as well. So we need to understand what exactly depression is and what sadness is. All of us experience sadness from time to time. So it's a basic human emotion. Sadness can come from multiple things, like a difficult day at work or an event or sometimes even a loss. And we can, go on about our daily activities also by being sad as well. But clinical depression is something just other than just being sad. So it's an actual medical condition wherein a person who feels persistently low, who has lost their energy, and there's no interest to do something they really like doing. And if all of this persists for at least 2 weeks or more, then we would say that the person is clinically depressed. So along with this, there could be things like when it affects their sleep, when it affects their appetite, or even their performance like concentration or attention span. All of this tends to get difficult. So I would like to give you an example in like a common language where I could explain it like sadness is like a passing cloud. It just passes away. But depression is something like there's a heavy fog and you're just not able to, lift it, and how much ever hard you try. But we need to understand that it's something which is very treatable. It is a medical condition similar like what we have diabetes or hypertension, which requires treatment, and with the right sort of treatment, it can be managed and people can, function better.
Absolutely, that's a good analogy. Beyond feeling sad, what are some of the other emotional and physical symptoms of depression that people might not recognize? I know for some people there are physical expressions.
Yeah, this is very important because depression, some people think that just being sad or feeling very low is only depression. But there are some less obvious symptoms also. Some people may feel like there is a deep sense of emptiness in them, whereas some other people completely lose interest in something they really like doing. So there are other symptoms like physical manifestations wherein they feel extremely tired, even like by doing minimal amount of physical work. Or there's an erratic pattern of sleep. Either they lose sleep or they continue sleeping a lot, and even their appetite gets disturbed. Either they don't feel hungry at all, or they end up eating a lot to compensate for their emotions. It can also affect their attention, their concentration, the way they think, and sometimes like even their thoughts, their movements, all of them become very slow.
So those are symptoms that may or may not alone point to depression, but a combination can help us understand whether it's sadness or depression.
There are also other symptoms like wherein a person starts complaining of multiple body aches and pains, which keep shifting. Like suppose one day you feel like your back is paining, and the next week there is like hand and leg pain. So there's a lot of somatic pains also, and they just are not able to function properly.
So sometimes if we feel like we're a little off for a couple weeks, 4 weeks, it could mean that we need to take a closer look at not just the lack of attention or one symptom, but think about everything together. Yeah. And we don't slow down much to think about ourselves. Sure. What are some of the factors that you would see in everyone that is a standard part of a diagnosis?
So commonly we see that they're consistently sad. They don't feel happy doing things which they like doing before. Even suppose someone really liked listening to music or dancing or watching TV, even for that matter, they just do not feel like doing anything. And there's also something where they feel very, very tired. So fatigue is one of the most common things we see in people. So if these are the three main things, and along with that there could be associated sleep, appetite, and attention, concentration. There's also lack of desires for things, for relationships. They want to isolate themselves. So these are the associated factors, what we could say.
So, is it biological, psychological, or social that can contribute to someone developing depression?
So depression, or most of the mental health conditions, I always feel, and it's also seen, that it's always multifactorial. We cannot say that it is because of one
No simple
particular thing.
answers?
Sadly not in mental illness, at least. So it's always multifactorial. We can't just say that one particular thing is leading to mental illness. Especially like depression, we see biologically the brain chemistry and genetics always play a role. So when someone has a trait to inherit diabetes, likewise someone can inherit a vulnerability to develop depression. That would be seen. And psychologically, certain personality traits play a important role. So if someone is highly self-critical, or they are extremely perfectionist, that can increase the chances. And emotional traumas or some subdued emotions in their childhood, that also plays an important role. And when we come to social aspects, isolation, lack of support, and financial stress or relationship issues, all of these socially also has a very big impact. So it's always like, suppose I could say that it's like a recipe wherein there's different ingredients, and then when it's seen in a person, then they end up developing depression.
I see. I love the analogies. What are some of the biggest misconceptions people have about depression and its treatment?
Yeah, so this is something I'd really want to address, because mental illness itself has a huge stigma, especially in our country as well as worldwide also. Some of the most common things about depression, especially what we see, is people feel like depression is just a symptom or a lack of willpower, they say like, try to be more positive, you'll get better, or try to, just brush it off, it's okay. It's like, telling someone with a fracture of their leg to just walk it off and your fracture will just get healed. So that's one of the most common things we see, where people don't believe that it's because of the brain chemistry and stuff. They just feel like it's someone making it up. That's one thing. There's another misconception about the antidepressants or the treatment
Yes,
protocols,
let's talk
especially
about medication.
the use of antidepressants, and how people believe that antidepressants need to be taken lifelong, or it can either change the person's personality. So I feel like it's just given so that people function properly, because antidepressants change or alter the balance in the brain between the neurochemicals. And when given for a specific period of time with the right dosage, people can we can taper it off also. It's not usually given for a lifelong condition as well.
I do understand what you're saying about the stigma and people being concerned about it changing their personality because of film, maybe because of an older family member. We've seen what someone looks like when they're on psychiatric medication, and we don't want that. We don't want slack jaw, drooling. We
Yeah.
don't want to be a zombie. That's it, oh, I
Yeah.
don't want to be a zombie. I don't want to feel my feelings, which is really so ironic, because if you become depressed enough, you were talking about interests, playing music, singing,
Correct.
dancing. If you're depressed, you're not doing those things,
True. Yeah.
but you will say, oh, but if I take medication, how will what if I can't sing anymore? What if I can't write music anymore? So there is a lot of fear and stigma about medication. But it's interesting to hear you say that for I think it's called situational depression, that there are medications that can be applied along with therapy
Yeah.
and get through.
Yes.
Yeah.
So we usually prescribe, suppose it's like you mentioned, situational, it's usually given for a period of say 3 to 6 months, and we also advise them to get therapy.
Right.
So with the right therapy and medications, we slowly taper them off, and once they're able to function better, we completely
over the
stop.
hump.
So
Yeah.
it's not like a hard and fast rule that you have to be on it for lifelong. Or also people feel like we're going to be knocked off. The most common questions we get asked is like, is it going to make me feel very sleepy, drowsy, and stuff? So that's not true, because we are also here to help a person function better. So
Right.
we would want them to get on going with their life. So that's something
Right.
we would not want someone to have. So depending on the dosage, depending on the person's condition, we adjust the medications and then we cater to their needs.
Right. That's a good mention, that it is about better functioning. So why would we turn you down?
Exactly.
We want to put you back in the center lane and going forward. That's one thing that people don't understand, that these medications are not narcotics.
True. Yeah.
So they're not going to fall asleep. Not that other things couldn't be prescribed with an antidepressant.
Yes.
But antidepressants alone, people shy away from that,
Yeah.
thinking that it's
going to,
narcotics.
yeah.
Yeah. Is there a specific point when a person should consider seeking professional help for their symptoms?
Yeah, this is extremely important, because see, all of us, again, like I mentioned, that people feel sad from time to time, but when someone continues to be low, when someone loses their interest and feels extremely tired to do anything, and it lasts for a period of 2 weeks or more, where they're not able to concentrate on work which they have, they lose their sleep and appetite, and the thoughts about themselves and about the surrounding world is also disturbed. It affects their functioning as well. So that's when you need to seek help. One more important thing what we need to understand is when someone starts having hopelessness feeling, like they feel like, what's the point of living, it would be better to just not live. That's a really important sign for you to seek immediate help.
When someone is diagnosed with depression, what does the treatment journey typically look like?
When a person comes with depression to the clinic, so apart from the symptoms, what we look into is take a detailed history, the stressors, what led them to this, the support system, the past experiences, the past traumas and emotional burden, what they have. We listen to all of that, make a personalized treatment plan, suggest therapy and holistic experiences like changing their diet, looking into their physical activity, and then if there is a need, we also suggest medications. So this is a personalized plan for each person. It's not a generalized one as such.
Right. That is the hump for me in times in my life that I've had depression. The first thing a doctor will say is, well, how's your physical activity?
Exactly.
I know intellectually that if I exercise every day, it will affect my brain chemistry and I will feel better. But as you mentioned, I'm listless.
Yes.
I have no interest. I can know I need to do something,
But
get
you
up
just
and
don't want to.
eat,
Yeah.
fix a sandwich. I can't. So that is the, I think anyone I've ever discussed this with, friends and family that have experienced depression, that's always the thing. And that's the first thing well-meaning people will say. Not just the doctor, you know,
True.
your
Yeah.
friends and family will, hey, why don't you come hiking with me? Because I don't feel like
It's not possible. Yeah.
it's very, very difficult. Is that something that a proper antidepressant can sort of get up and over that line where you just can't do activity?
You can. The antidepressants will help you get that motivation and help you
Motivation, that's the
function
word.
better. But it also depends on the person, because they would want, like, if you want to get better, you'd really put in that effort. Because so many people believe that I just take the medicines and I'll be fine the next day. So that's not something what we need to do. We need to put in an effort from us, our end as well. Because I always say to patients that it's not like, you just take paracetamol for fever. The fever automatically goes away. But
Right.
for mental illness or mental health conditions, there needs to be an effort from your end as well. That's when the medications work wonders.
With
So,
therapy,
with therapy.
combined with therapy, yes. There is no
So it's
magic bullet.
always therapy, medications, your efforts.
No magic
everything.
bullet for weight loss, no
No.
magic bullet for depression. Yeah, you have to come at it in a
Yes.
holistic way. Can you explain the roles of both therapy and medication in recovery? Why do I need both?
So, therapy helps people understand their thought processes, build their coping strategies, explain, past traumas, and helps them to manage their emotions in a better way. Medications, on the other hand, work at a biological level. So they alter the chemicals in the brain chemistry, and then it helps for therapy to work better. So it's not always either of it. It's always a combination of therapy and medications at specific for the patient.
For those who are hesitant about medication, what's your message to them about its role in treating depression?
So medications are important. It depends on the condition or the severity of the illness as well. If it's a milder form of depression, personally, I would suggest try therapy first, see the improvement. If things drastically don't improve, then I would suggest medications. For more moderate or severe forms wherein there is self-harm tendencies or disturbed sleep, which is affecting their functionality, then definitely medicines play an important role. I would actually like to, give you an example where glasses don't change the eyes. It helps you see better. So I believe that medications for mental illness is just like glasses for the brain, wherein you function in a better way so that you go back to your actual lifestyle.
Let's talk about support and practical advice. For our listeners who know someone struggling with depression, what is the best way to offer support and encourage them to seek help?
Yes, sometimes if we see people who are going through depression, we feel very helpless because people don't know exactly what to do. So the most easiest and the most simplest thing is to just be there with them. it would be like, suppose someone is in a dark room, it'd be better if they feel like there's someone next to them rather than someone standing outside the door and telling them, switch on the light, switch on the light. So just your presence itself would be better, and just non-judgmental, and not having that immediate rush to give advice is always the best kind of first aid treatment. And later on, as the person slightly starts talking to you and stuff, encourage them to seek help. Along with this, it would also be encourage them to seek help, but not very obvious or not pushing them too much. And just offer them, help, saying, I would like to be with you when you go for your first visit to the psychiatrist or the therapist, because just knowing that they're not alone really gives them a lot of strength. So that's something I would tell people to do. So it could also be like checking in, leaving in a message, or sharing meals together, or just, calling them out for a cup of coffee or something. All of these are minute things, but it makes a lot of difference for someone who's going through it.
That's lovely. Good thing to remember. What is one key piece of advice you would give to someone who is currently on their recovery journey?
I would say that recovery in mental illness isn't always linear. It's going to be like a winding road with lots of ups and downs. So I would say, be patient and keep going, because sometimes, most of the days, you feel very confident, you feel better, but on some days you feel like you've just taken 10 steps back. But you just need to remember that, setbacks are not going to erase your progress. So minute things, simple things like just showing up, taking medications, or attending therapy sessions regularly, prioritizing yourself, your health, and your nutrition, and talking to people. These are all of the things which smaller efforts are going to make a big change eventually. You may not see the progress immediately, but it's going to happen after a while. So patience is the key.
Trust the process.
Yes.
That is so a frustrating saying.
I know, I understand, but especially in conditions like depression, it's always a gradual growth. It's not going to be immediate like other conditions, which is why people sometimes lose that interest, or they don't tend to follow up, because they're like, we've taken medications for 3-4 days, where is the improvement? So that's when we'll have to keep reassuring them that you are going to get better. It's just going to take a little bit of time.
Dr. Manasvi, can you share a story with us? Maybe something that was much easier than the patient thought it would be when they came?
Sure. At the top of my head, it would be, recently I had a patient who was, feeling really upset after a recent loss in the family. And also there was financial concerns as well, and had a difficult time at work. So there was a lot of things happening at the same time. But then they thought they could do better, because she was doing really well before. So she thought, I have it in me. I am an athlete. It's just about being active. So I will just continue doing my regular physical activity. So I'll get better. It's just about pushing ahead and moving forward and stuff. But she tried doing it, but didn't get better. And then she went sort of seeking help to her coaches, her life coaches, and who also said, do breathing exercises, or change your diet. And but it
Right.
was at a level where she was doing all of that, but still there was not much improvement. There was a lot of sleep disturbances. She was feeling very anxious at sometimes. She was not able to focus on her work as well, breaking down immediately, crying about it. And she started also having like a lot of suicidal ideations. So that's when a friend of hers suggested that, pushed her a lot, saying you have to seek help. And she thought it's going to be a mammoth task, because she's like, no, it's not for me, I can do better and stuff. And she thought it
Right.
would be like, she would be on a lot of medications because she's delayed. But then we just treated her with one medicine and made her take therapy as well. And within like 6 weeks, I guess. She's doing so much better, and she in fact came and she was like, I didn't think, it would be so easy, but things just improved. So that's something happened recently, so I just wanted to let you know.
Yeah, I think if a person is really high functioning and really
Correct.
productive,
Yeah.
then their belief is that I can get back to that, I can get back to
True.
that, but sometimes we can't. Those are whammies.
Yeah.
If you're talking about loss of a loved one and financial,
Yeah.
those are the biggies, right?
Yeah. And she was trying to be this, she was the support system for a lot of her other family members. So she didn't have a place where she could break down as well. And she thought, I can take it all. So that's something.
That's a whole nother
Yeah.
conversation about the role we play and how
Definitely,
we think we need to fulfill it all the time.
Yes.
So maybe we'll get another chance to talk some more about family dynamics and how they might play into depression or anything you might like to talk about. I loved
Sure.
having you. I loved having you.
Thank you so much.
Okay, thanks. That was a very good discussion here on the Mind Reimagined. I hope you'll join us on the next podcast when we discover paths to wellness. This is Ellen Chamberlain. Thanks for joining us. You've been listening to the Mind Reimagined, Paths to Wellness. Continue to tune in and heal within. See you on the path.